Prostate problems, symptoms, causes, medications, therapies, and natural remedies. Prostate problems are common among men, especially those over 50. The most prevalent conditions include benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. Each presents different challenges and requires appropriate attention. Symptoms: frequent urination, especially at night, difficulty starting or stopping urine flow, weak or interrupted stream, pain or burning during urination, erectile dysfunction, pelvic, lower back, or groin pain, often in prostatitis, blood in urine or semen, more serious, possibly cancer-related. Causes: hormonal changes with age, bacterial infections for prostatitis, genetic predisposition, prostate cancer risk, diet and lifestyle choices, chronic inflammation or immune response irregularities, medications, alpha blockers, e.g., tamsulosin, relax prostate muscles to ease urination, 5-alpha reductase inhibitors, e.g., finasteride, shrink enlarged prostate, antibiotics for bacterial prostatitis, pain relievers, reduce discomfort, hormone therapy, used in advanced prostate cancer to lower testosterone, chemotherapy or radiation for prostate cancer treatment. Therapies: transurethral resection of the prostate TURP, a surgical option for BPH, laser therapy, less invasive procedure to remove excess tissue. Prostate massage therapy, sometimes used in chronic prostatitis. Pelvic floor exercises, strengthen bladder control, immunotherapy and targeted therapies for certain prostate cancers. Natural remedies: saw palmetto may help reduce BPH symptoms. Pigum bark supports urinary health. Pumpkin seeds, rich in zinc and beneficial for prostate health. Green tea, anti-inflammatory and antioxidant effects. Tomatoes, lycopene, linked to reduced prostate cancer risk. Regular exercise improves hormone balance and reduces inflammation. Healthy diet: low in red meat, rich in fruits, vegetables, and omega-3s. Stress reduction: yoga, meditation, and adequate sleep can aid healing. Conclusion: prostate issues are highly treatable when detected early. Men over 40 should prioritize regular checkups, including PSA tests and digital rectal exams, DRE. Combining medical treatment with lifestyle changes and natural support can greatly improve quality of life and long-term health.